Good morning and welcome to the show. My name is Koi. Now, according to a recent report in Kenya, cancer patients have to travel from across the country, some as far as 600 kilometers away, to access treatment. Diagnostic services are available mainly in the capital and large cities, but are limited in capacity. Now, today we go into the Aga Khan University Hospital and learn what takes place in there. Stay tuned for that.
The main factor that determines the successful treatment of cancer is the timing in detection. The earlier the cancer is detected, the more successfully it can be treated. One of the surest ways of telling if a patient has cancer is through a tissue diagnosis. This process involves extracting a small part of the patient tissue which undergoes different tests.
This is where the whole process of tissues that come to us for diagnosis starts, and this is what we call our grossing room. What we are seeing behind here is one of our residents, because we have residents in histopathology and anatomic pathology, and one of our residents is grossing. When we say grossing, we mean when we receive specimens, he's going to be able to look at them, he's going to describe them, he's going to identify where they come from, which part of which institution they come from, and what the clinical history is, and then he's going to gross them, and he's going to take sections. So we can't, because some of the tumors are really big, so he will not be able to take everything and process everything. So he'll take a piece of what we call a representative section. We put them in special things called cassettes, and they're processed overnight in these processes, which are automated. The next morning, this is what the tissues look like when they come out. So what we do, we use a solid medium to support the tissue so that it's hard, it's firm, and we are able to then, the knife is able to cut slices, very, very thin slices. So this is called an embedding station, and that's where we do, and we have paraffin wax. There's paraffin wax in this bath, and we pour the wax at a certain temperature to make the tissue firm, to have a medium, solid support, and then it comes to this ice here where the paraffin is cooled. So this is what it looks like. So here is your tissue, here is your medium that supports it. So you're able to, our technologist is then able to cut slices. She's cutting these tissue blocks into slices, very, very thin slices. So one of the first things she does is to make sure that the surface of that block is aligned. So she trims off all the excess tissue, and then she gets a nice ribbon, and it's very, very thin, and she'll float it because it's all wrinkled up like tissue paper. So she has to float it so that it sort of straightens out, right? And it stretches, and this is at a, at a certain temperature. It has to be done at a certain temperature. She'll pick up the tissue, and you can see that's how it is. So this is a slide with the tissue. It's a section of the tissue. We can't see it under the microscope because it's not colored. We need to see color to be able to make a diagnosis. So then from the slides, when the slides get here, now those are the slides of maybe cancers that we diagnose, or it could be any other tissue. It could be an appendix, for that matter, appendix that's removed for just acute appendicitis. So this is again an automated stainer, and it's able to color, it's able to dye the cancer or the cells and the tissue that's on that slide that you have seen. And when you come from here, therefore, so this takes a certain number of hours, a few hours, for the slides to get stained or dyed, and they cover slip the slide so that it's covered, the section is covered, otherwise it will dry out. And then these are ready to be dispatched now to the pathologist or our resident for reporting. This machine is very, very important because it freezes tissues at very, very low temperatures, like -20. So the tissue is, as soon as you put the tissue in, it just automatically and immediately freezes the tissue. And how does it help? If a patient is in theater and the doctor needs a stat diagnosis, he needs to know, is this cancer? Or he knows already that it's cancer, but he wants to know, when I'm cutting out the tumor, are my margins clear? Because margin clearance is very, very important for subsequent management of the patient. So the margins are not clear, then that means the chances are that the patient may have a recurrence of the tumor. So you want to tell the doctor, yes, While the patient is in theatre on the table, we are able to make that diagnosis and tell them, yes, A, whether it's malignant or confirm that it's malignant, and B, whether the margins are clear.
Upon establishing that a patient has cancer, the doctor designs a treatment model. Cancer is treated through a number of ways which are patient-specific, depending on the area the cancer cells have affected and its level of advancement.
Sometimes a patient may be very ill and may not be able to tolerate chemotherapy, even though it is required. Sometimes it is based on, well, obviously on most times it is based on tumor-related factors. So the stage of the disease matters, how aggressive it is matters, where it is located, whether it has spread or not. All of these things come into play when we make a decision about any treatment modality.
One such type of treatment is chemotherapy, which works by attacking the cancer cells and stopping them from growing further.
For the chemo drugs, the cytotoxics, we do them here in an enclosed wood because we'd like to protect ourselves as the workers who deal with the drugs. The air that is in here is not like static. It's air that is flowing from up, down in a circular motion. Yeah? So once it flows, it purifies it. There is an isolator that ensures that the air inside is purified. This is a pass-through chamber. So given that you don't have an exit, this is the door that you use. You'll pass in your drugs first. You need to have to wait for a minute as you're taking the drugs in for mixing, because still they're intact, they're closed. Most of the chemo drugs are given as an infusion. A few are given as bolus, and others are oral. So the ones that are given as infusion, we have to mix them in a fluid. That is either normal saline or dextrose for those that are stable in dextrose or DNS. Those are replacement fluids, I'd say so in a language that you'd understand. So you get the drug, you get the fluids, and you do the mixing in the wood now. Because it is something that maybe can be done by the nurses in the ward, but now it means you'll be exposing all the other patients in the ward or all the other patients in the daycare unit with the cytotoxic drugs. So that's why we do this separately, such that by the time it leaves the pharmacy, it goes as a compact thing that is not being, we don't expose other patients to the cytotoxics, because when it gets to the ward or it gets to the daycare unit, it just hangs and it runs through a tube into the patient, and that is all. There are those drugs that come as a powder, and there are those that come as a fluid. So the ones that come as a fluid, it's a matter of withdrawing, and you have to be very cautious to avoid pricking yourself, because that's another way of exposing yourself to the drug. So you have to be very, very careful when you're doing it, and it has to be in a way that you don't contaminate the drug. The number of drugs that you mix are patient dependent, because first it depends, whatever the patient will get, it depends on what cancer is being treated and at what stage is it. We use combination of drugs, which are of different classes. They work differently targeting the cancer tumor or cancer cells. So they'll work in different ways. They're used in combination so that their synergistic effect can be able to kill the cell in different ways, that is.
One of the main drawbacks of chemotherapy is that it kills both the cancer cells and the good cells indiscriminately. Radiotherapy, which employs the use of high-speed ionizing radiation, similar to X-rays, is also used to attack the abnormal cells. Just like chemotherapy, it kills off normal cells, but in this case, the cells usually repair themselves.
For radiation, the side effects are local because the radiation is a local treatment. Unlike chemotherapy, it does not circulate in the body. So for instance, if you are treating the brain, then obviously one of the effects will be loss of hair. If you are treating cancer of the throat, then you will experience a sore throat, difficulty swallowing, painful swallowing, sometimes a change in your voice as well.
Sometimes a combination of surgery, chemotherapy and radiotherapy are necessary to completely eliminate the cancerous cells as well as to stop recurrence.
Surgery is probably one of the mainstays of cancer treatment. In many cancers, a good operation is essential, where the tumor can be removed completely and cleanly. How aggressive the surgery is depends on also the morbidity that the patient may suffer as a result of that operation. Sometimes to decrease that morbidity, we will combine things like chemotherapy and radiation prior to doing surgery so that we might minimize the amount of tissue that has to be removed. An example of that, of course, is in breast cancer. More and more nowadays, if a woman presents with a locally advanced disease, oftentimes she is treated up front with chemotherapy in the hopes that it can shrink the tumor enough that the surgeon can go and do breast conservation surgery so that the woman does not have to lose her breast. In tumors like osteogenic sarcomas, which affect the bones, and often in younger children, the goal is to do chemotherapy and then surgery followed by more chemotherapy with the hopes that the surgeon can spare the limb so that you don't end up with an amputation.
The frequency and duration of treatment depends on the type of cancer, the stage of cancer, and the general health of the patient.
The length of the treatment, again, depends on the tumor, depends on the treatment regimen. For instance, on average for radiation, if you're treating with the intent of curing the disease, it can be anywhere between 5 to 7 and sometimes 8 weeks of therapy. For instance, prostate cancer treated radically with radiotherapy will often take just a little over 8 weeks of treatments given on a daily basis. For breast, after the patient has had surgery and chemotherapy, and then we have to do radiation, usually between 25 and 30 treatments are sufficient. So it does tend to vary, but for when you're treating for cure, then the length of the treatment is quite long. For chemotherapy, some regimens call for 3 treatments, some call for 6 treatments, some may even go on for 12 months. So that can also vary quite a bit.
According to Dr. Farouk, cancer presents itself in a number of ways, and it's therefore very important for one to be aware of their normal body functions.
If you find something that is not working normally, for instance, you've had a change in your bowel habits, you might notice bleeding, then those kinds of things should trigger some warning bells. It's not always necessarily due to a malignant process, but it is something that should tell you you need to go seek medical advice. In the same way, if you are a smoker and you complain of cough, shortness of breath, coughing up blood, change in voice, then again, those are some of the signs and symptoms associated with lung cancer. So depending on the part of the body, the warning signs can be different. Sometimes it can be silent. For instance, in breast cancer, the lump that is growing in the breast may be completely asymptomatic. So one way of detecting it is to do breast self-examination.
Contrary to popular belief that cancer is a death sentence, when detected in its early stages, there is a good chance that the affected cells can be eliminated completely and the individual can live a cancer-free life. Join us tomorrow as we delve deeper into the cancers affecting mostly women, namely breast cancer, cervical cancer, and ovarian cancer.
Since every cancer and every person is different, an accurate diagnosis can mean the difference between getting and not getting the most effective treatments you need to fight the disease. Remember to get a second and even a third opinion so as to get accurate results when in doubt. Send us your comments to midmorning@standardmedia.co.ke, or better yet, go to our Facebook page, KTN Midmorning, like it and drop in a comment. That's all we do have for you today. Enjoy the rest of your day.